Plastic Surgery Talk, brought to you by Mentor, maker of memory gel breast implants.
Welcome back to Plastic Surgery Talk. We're talking about soft tissue fillers today, and we're here with Heidi Hermond and Chris Inglefield. Chris and I, Heidi, I have to tell you, we're a little bit overwhelmed because we are sitting here with a recent supermodel. You just did a fashion shoot, we know. So if we're acting a little bit shy, it's because So tell us about that.
Well, you're embarrassing me now.
You didn't think I know about that, huh?
He's being really funny. Okay, no. It was a beauty.
It's
page.
a very cool thing, and
you
should be proud of.
It was a beauty page we did with More Magazine. It's to sort of prove that older women, like me, are still active and vital, and so we worked with them.
That's great.
And sort of generated an interesting beauty page that was very well received. But
it went over to the UK, huh?
If all of our older women looked as good as you, we'd be out of business.
All right, so
kind.
we usually get questions emailed to us about plastic surgery, and I would just since we've got your expert minds here, I wanted you to answer some. We actually have some that we've got off the street, just questions about plastic surgery. So let's take a look.
Do the results of Botox or similar products last?
Great question. What do you think?
Okay, so a typical Botox, and now there's a new botulinum toxin, either one. A typical length, I think, is about 4 months. Some people get more out of it, and now we're actually looking to see if really individualizing based on the muscle thickness and strength will change that variable, the length. But I would say anywhere between 3 and 5 months. Would you agree?
Yeah, absolutely. I think there's a great variability in just people's biological response to anything that you do, and Botox is no different. I think 3 to 5 months is certainly my experience.
And we have a second question, so let's take a look.
How do I know if I get Botox, I'll still be able to smile?
That's a really good question, because I think that goes right back to think what Heidi said with the fillers, is that it's important to be assessed accurately and properly by a well-trained physician who is going to be able to analyze your muscle movement and your facial expression, and therefore tailor the treatment to what you need as an individual, and the audience needs to recognize this. Botox is a very simple treatment, but it should not be done by the beauty salons and the non-medical field.
Right, I think that's a very important point.
Very important. There is another very important point, Bill, and I totally agree with Chris, but I think there's this notion that if something is good, more of it is better. And I think, again, this is really important to bring up. If a little Botox is good, a lot of Botox is not necessarily better. If a little Disport is good, a lot of Disport is not necessarily better.
And and you just brought up one other quick thing I want to have each of you just touch on, is that now in the United States, Chris, you've had this available to you for some time, but in the United States we have a new Botox, so we have Botox, and then we also have Disport now, and patients want to know, well, is one better than the other? What do you answer that, Heidi?
There's no indication that one is better than the other. I think now it's all about choice. It's like about Juvederm and Restylane. It's like Coke and Pepsi, Advil and Motrin. I mean, it's about I think it's a great thing to have more choices, and it will just push us to understand how botulinum actually works. But we do have a choice now. I think they're both comparable from what we can tell. There may be some minor differences. Disport may start working a little earlier, but they both are effective. It looks like they're gonna last as long. I don't know, because you've had it now.
Chris, have you used it? What do you think?
I've used both for over 5 years and longer, and really, my experience, no real difference. We have Botox patients who have an early onset, Disport patients who have a later onset.
That's interesting.
There's really no difference. I tend to use Disport for the patient who seems to have a little bit of a resistance to Botox, and we switch them to Disport, and we maintain the good. But one of the points I want to bring up with you talked about less is more. The trend has definitely changed over the last probably 5 years, of more subtle changes with toxin treatments that are getting away from the frozen look, which I think a lot of the audience are concerned about. I don't want to look frozen. I don't want everyone to look at me obviously like we've seen Kylie Minogue saying that she's finally admitted that she's had Botox to her forehead. Those are the type of things that we want to really subtle appearance, but good
Absolutely.
improvement.
I have a question for you. Do you feel that Disport has a softer look in certain areas? Because there's this whole question whether it may have a softer effect. Do you feel like there's a difference?
No, I think it's all about dosing.
Really?
I think physicians who have not had a lot of experience with Disport have actually been overdosing compared to what they would normally use with Botox.
Interesting.
So therefore they get a more denser.
So go gentle.
Go gentle.
Go
Well,
gentle with any Botox.
yeah.
Any botulinum toxin.
That's great. It's great information. Well, it's really been a pleasure having you both on the show, and I certainly have learned a lot, and I'm sure all our viewers did as well. So thank you very much, and we'll look forward to you being on the Plastic Surgery Channel in the future.
Thank you. Thanks for having us, and I've learned so much.
Pleasure.
So it's been great having you with us today. I hope you learned a lot about soft tissue fillers from our experts. Make sure to send your comments to us at info@theplasticsurgerychannel.com, or you can send us your tweets on Twitter. We'll see you next time.